Hello, and welcome back to the GPHI Science Podcast. I'm Dr. Liana Lianov, the president of the Global Positive Health Institute, and I have with me our board secretary, Simon Matthews. Welcome. I enjoy
Thank
doing
you.
the science podcast with you.
Likewise.
And we are diving into the topic of gratitude today. And of course, gratitude is a huge area of research in positive psychology. And I encourage you, if you're interested, to dig into it. Today, we're just going to take a little taste of one great study by a colleague, Dr. Patrick Hill, and his co-authors. And actually, Patrick Hill joined us for our Meaning, Purpose, and Spirituality Summit recently and has done some amazing research in positive psychology, and particularly focusing on these kinds of interventions and their impact on physical health, which we're particularly interested in healthcare and as health professionals. So he's got this study that he published in the Journal of Personality and Individual Differences that is examining this relationship between gratitude and physical health. What are those mediators, and how does that vary across the lifespan, across adulthood? Specifically, they were looking at dispositional gratitude. So, Simon, can you share with us what dispositional gratitude is?
Yeah, I sure can. So one of the easiest ways to think about it is in terms of probably some psychological terminology that perhaps a lot of listeners are familiar with. Back when I was a psychology student, we learnt about state and trait, or state and trait, if you prefer the correct pronunciation, TRAIT. So the idea is that some of our personality features seem to just be an enduring part of us. Others are activated in a moment. So the state, for example, if I give you a gift right now, Liana, you will probably say thank you. You better say thank you. No, you'll probably say thank you. And that's state gratitude. That means in that moment, you feel a moment of gratitude. Dispositional gratitude, of course, is just the enduring tendency to go through life experiencing gratitude for all sorts of things. Who you are, the city you live in, the resources you have, the people you have around you. You wake up in the morning and the sky's blue, you feel grateful. You wake up in the morning and the sky's grey, you feel grateful. You wake up in the morning and it's thunderstorming, you feel grateful. It really doesn't matter kind of what's going on. The idea of dispositional gratitude is that we have this enduring sense that kind of overrides all the kind of daily variations of life.
Yeah, yes. It's an enduring part of someone's personality, their
Yeah,
disposition,
exactly.
as the word
Exactly.
says.
Yeah.
I wish I could say that I have a dispositional gratitude. It sounds quite lovely because it sounds like you go through life a little happier, I would imagine. And
Yeah.
again, as we're interested in, well, then how does this impact our physical health? And in this particular study, they were looking at dispositional gratitude and self-rated physical health, and what are those mediators or those factors that connect the two. And what they looked at was that it impacts psychological well-being. So there's a psychological pathway. There's also a potential healthy behaviors pathway, right? With gratitude, you may be more apt to fulfill and do healthy lifestyle behaviors, which we recommend in lifestyle medicine. Also, there's a mediating factor potential of just one who is more grateful, seeking out help when they think they need it, when they might have a medical concern or other concerns. And so Patrick Hill and his colleagues put this into the study and tried to tease out what was most powerful. And what they found was that actually the psychological pathway was the most powerful. And that explained fully the mediation between dispositional gratitude and physical health. The healthy behaviors and the seeking help when we think we might need it were only partial mediators, but still had some impact. So that's all very interesting. And they also were looking at which age groups through adulthood are impacted the most by this kind of dispositional gratitude. And those who were older, in the older groups, tended to benefit more, again, in terms of how they responded on self-rating their physical health. So these are both important takeaways from this study.
We've had a similar conversation in a different one of these podcasts, Liana, about savouring and the effect of savouring seeming to be greater in older people or older generations. And I will say I'm not quite sure why that is. I have a hunch, I have a theory, and my theory is that the more of life we get to experience, hopefully the more able we are to develop a longer term, steadier perspective on everything that life has. And to me, that suggests that, the older we get, the more likely we are to be able to connect with those moments of, or the importance of really grabbing onto a moment and experiencing it. And the more likely we are to be able to say, life's kind of okay. I'm doing all right, and there's plenty of things that I can be thankful for.
Yes. Clearly, this has great implications for our own self-care, our what we do for ourselves to promote our well-being. We have many listeners in our audience who are health professionals, and this has clinical applications. And how would we be thinking about this in terms of our patients? What ideas do you have there, Simon? And what have we learned so far?
So I think that we know that, as you've shared earlier, Liana, that this idea of dispositional gratitude is a good predictor of several things, and also those several things are good predictors of dispositional gratitude. So I don't think we can avoid the kind of circular causality there, and I think that's important to acknowledge. But we do know that when we're dispositionally grateful, our psychological health is probably going to be better. That in turn leads us to engage in kind of, if you like, life-giving activity, activities in which we seek to have that experience of thriving. And that in turn then becomes a predictor of our own physical health as well. And it's not difficult to imagine the way in which that becomes cyclical. The more we look after our physical health, the more mentally healthy we're likely to feel, and so on and so on. And the more that we can develop that, the more that's likely to develop into a long-term cycle across the lifespan. So in many ways, we kind of swing back to our dear friend lifestyle medicine and need to recognise the value of establishing those practices as early on in our lives as we possibly can, because it becomes a little like it becomes a little like investing money in a bank. The longer your money sits there, the more interest it accrues, and the greater value it has 20, 30, 40, 50 years down the track. And our physical health, our psychological health, I think, work in pretty much the same way.
Yeah, well said. And this, of course, is very important for uh, patients that we see that are facing difficulties in the moment, or they've faced traumas in the past, have had stressful lives, and we're looking for ways to boost their positive affect and decrease their negative affect. And this gratitude practice. And there are other studies that talk about intentional gratitude practice that are not part of this study, but good to keep in mind that even if someone doesn't have that disposition, natural disposition, there are
Yeah,
things that we can learn to do and get the same benefits or similar benefits.
absolutely. Yeah,
But back to the study, specific again to dispositional gratitude and physical health, because it is, I found the study very interesting because it is one of the few studies that's really looking rock solid on this connection. But it does beg the question, because it's looking at self-rated physical health. What are the connections between gratitude and objective measures of physical health? And we don't quite have that. So future research is
yeah,
going to need to
yeah.
take a look at that, as well as what we looked at. We talked a little bit from the study about the age groups, that the older age groups tend to seem to benefit more. But what about other cultures and other populations and groups? So there's more we need to learn. And in fact, I
Yeah.
know of at least one study that I often talk about when I do presentations that show that gratitude practice may actually be more powerful in Western-based individualistic cultures rather than more collectivist Asian cultures. And a collectivist culture expressing gratitude is almost associated with an indebtedness to
Mm,
someone, and that may have some negative repercussions. And that's
mm,
just as an example of how there might be a variety of ultimate outcomes, psychological and even physical, of a particular intervention in positive psychology in different groups. So it's, again,
mm.
important to keep in mind. So we have so much more to learn, as well as to compare these different kinds of interventions. So we've been talking
Absolutely,
about
absolutely.
gratitude, but there's acts of kindness. Yes, there's savoring, there's forgiveness. Quite a broad field of positive psychology. And it'd be nice to compare them and their intensity and in different groups so that we can refine our recommendations for our patients and what we do for ourselves.
Yeah, there's a couple of things worth saying from a clinical perspective too. I think
Yeah.
here, Liana. The first is that in some associated or similar research, Sonia Lyubomirsky has demonstrated that a significant part of the happiness that we experience from day to day appears to be dispositional. We kind of have it when we're born, if you like. A small amount of the happiness we experience is mediated by daily events. If you happen to win Powerball tonight, you would probably be happy. But another significant chunk of the happiness we experience, we can create ourselves. And I suspect that the same thing happens with gratitude. We've been talking about dispositional gratitude, and even for someone whose level of dispositional gratitude is comparatively low, I think one of the important hopeful messages that we need to bear in mind is the idea that we can nevertheless create moment to moment to moment to moment of gratitude. Now, that needs to be tempered by the idea that we should not force gratitude upon someone else, which is clinically unhelpful to do. But instead, one of the things that I learned many, many years ago from from my family therapy training is the idea of inviting people to observe without the pressure to change. So, for example, if I were working with a client or a patient who was having difficulty connecting with experiences of gratitude, then what I might invite them to do is in the coming week, pay attention to any moment in their day-to-day life where they happen to notice that they're feeling just a little bit more grateful than they usually do. And that's simply an invitation to the person to become an observer of their own life without any pressure to feel grateful or express gratitude or something like that. And those interventions, although seemingly small and seemingly just nudges, are often sufficient to prompt someone to pay enough attention to their experience that they start to notice some fluctuations that they haven't previously noticed before.
Yeah, I'm glad you brought this out, Simon, because this also brings to light that these are delicate interventions and practices, yeah, we certainly don't want anything to feel forced. And even if we are looking to make some recommendations, like if I do a gratitude journal, how often should I do it? Exactly that. Dr. Lubomirsky has found that there's a sweet spot, that
Yeah,
if
yeah.
we sit
If we
down to
can do it too
do
much.
a journal, it can backfire. If we do it too much, we
Yeah,
become resentful, like, here I go again. What am I
yeah,
supposed to be grateful for
yeah,
today,
yeah.
rather than really reaping the benefits? And so in her research, she's found that, we have to find our own sweet spot, but probably, once or twice a week is plenty if you want to build it into your life. And so we're talking about, beyond the study, which is on dispositional gratitude, some of the more practical tips, which we can't avoid to share because they're important for everyone to keep in mind. And this area of gratitude is very well studied in positive psychology, and it's an important tool in our toolkit for positive psychology. So I'm delighted that we've had this opportunity to talk about it. And as we close, Simon, how are you using gratitude, or anything different you're going to do for yourself?
Well, Liana, I'm very fortunate in that I just happen to be, and I can take no personal credit for this. I mean, it's dispositional. I just happen to be someone who finds it pretty easy to connect with experiences of gratitude. If you ask me to, name 10 things that I'm grateful for today, I could do that very easily. So, so I'm additionally grateful for that in my life. I'm grateful that
I'm
I
grateful for
experience
being grateful.
high levels of dispositional gratitude.
Yeah.
But I also want to be very clear that it's not something I'm proud of. It's not something to boast about, because
Yeah.
it's not something that I've striven to achieve in some way, strive to achieve. Just
Yeah.
happens to be who I am.
Yeah.
I will just, I guess, continue to, wander through life and pay attention to those things that I feel grateful for.
Pay attention to the good things. So that's
Yeah.
terrific. And for myself, I don't know that I have a uh, natural disposition towards gratitude, but I do tend to have the self-talk. This is another way in my mind. And when something's not going quite where I would like it to be, I do tend to help myself feel better by saying, this isn't going well, but this is. I try
Uh-huh.
to
Uh-huh.
argue against just sticking with the negative. And so that's a kind of a personal gratitude there. And
Yeah.
and so
Yeah.
I find that comes naturally as well. So we each have the benefit of being able to tap into this broad array of practices under this umbrella of
Yeah.
gratitude
Yeah.
and positive psychology.
I might say you have a natural capacity to maintain perspective in your life.
Uh-huh. I like that.
Yeah.
Thank you.
Yeah.
So thank you for this science podcast, Simon Matthews, for joining me, and thank you to our listeners for joining us for this GPHI Science Podcast. Please subscribe, and please join us for another one of these. And take care. Be safe. Be well. Until next time.